This evening, we are going to have a short session, and it's about hospital disaster preparedness and response. And this still is in the same module of hospital infrastructure. So we want to handle and want to see really what happens in the hospital disaster preparedness and response in relation to hospital infrastructure. So I want to start by actually us understanding what is hospital infrastructure. Is contained and what you are supposed to understand and know in relation to or damage and deterioration of health and health services on a scale that is sufficient to warrant an extraordinary response from outside the affected community. So that is according to World Health Organization. And for them, they look at anything that can disrupt or cause loss of a human life or deteriorate the health and the health services in such a scale which will lead to actually affecting the community that is actually within that disaster. So the other definition is it's a catastrophe or a calamity which results in loss of life and property. So this is all in relation to disaster, and that is what disaster means. So when there is a disaster, we really need to actually see that we are able to uh, adequately prepare and respond to it. So the readiness of healthcare facilities to effectively respond to disasters is actually crucial for safeguarding the lives and well-being of patients and the staffs in that hospital. So this presentation is going to explore some key aspects of our disaster preparedness and response in hospitals. Since this is a topic that is handling hospital disasters, so in most cases we are going to talk about hospital disaster preparedness and response in hospitals.
The last time we were able to discuss, we looked at the different methods of using assisted reproductive technology, and today we shall go deeper
In relation to hospital or the hospital setting
to be able
can be
to
reduced, and
understand
this is if there is
and look at some
identifying clear identification and mitigation potentials to some of these hazards and vulnerabilities affecting hospital operations, and that is during disasters. So this will involve
these assisted
the process of identifying and mitigating some of these potential hazards before they actually happen. So that is how we can do the risk
areas that help
reduction to assess the hazards associated with
with the sperm. Artificial technology taught the embryos to increase the
components. We need also to look at the structures, and we need to improve some of our structures, and also the emergency preparedness. We need to train most of our staffs to be able to handle the emergencies, and this will help us reduce some of the disaster risks in our hospitals. So disaster risk reduction is basically looking at some of the strategies that we have already mentioned, and if we are able to do that, then we shall be able to reduce some of the risks in relation to disasters in our hospitals. So hospital disaster response plan, in everything that you need to do, you always have to draw a plan. So a well-defined plan is actually essential for coordinating hospital resources during the time of disasters. So the components which include risk assessments, response procedures, resource allocation, and roles and responsibilities of different individuals in the team. So hospital disaster response plan is very, very important for us to have in all our different hospital or health facilities. And we need to see how to make sure that we have the risk assessment. We have to provide different resources, and those resources have to be allocated appropriately, and each one has to know his role and responsibility in that plan. So it's very key to have a disaster response plan so that you can be able to address some of these disasters in case they happen or they occur in our different hospitals.
should explore more.
And in every activity, there has to be a team. So we need also to know what happens with the hospital disaster response team. So the hospitals actually establish some of the specialized teams that are trained actually to respond effectively during these disasters. So it's not that picking anyone anyhow from anywhere, but these are specialized kind of teams that have been trained so that they can be able to respond effectively when a disaster occurs. So these teams may include the medical staff who are trained to handle some of these emergencies. Then security personnel are also, we need them as our one of the response teams. Then logistics expertise, we need logistics to help us address as one of the resources, and crisis communicators. So when there is a crisis or when there is a disaster, we also have to see that we are able to communicate so that we can be able to lobby support from other various different either organizations or different individuals when a disaster occurs. So it comprises of us actually multidisciplines disciplines and specialties that activate and respond during emergencies. So having mentioned the different teams and including the medical staff, security personnel, logistics expertise, and crisis communicators, that actually comprises of a disciplinary committee or disciplinary team. They are multidiscipline, meaning that they are of different disciplines or they are of different professions, they are of different skills that are able to handle different aspects in relation to disaster. And the specialties also matter because not everyone is able to handle different kinds of disasters when they occur in our hospitals. So multidisciplines and specialties are very key in these hospital disaster response teams. So hospital disaster response equipment and supplies, we realize that we cannot provide these services, or we cannot respond when we don't have the equipments and we don't have the supplies. Sometimes some kind of disasters can occur and you cannot do without having an equipment to help you address the disaster, or the supply to help you address the disaster. So we want to understand what are some of these equipments and what are some of these supplies that we really need to help us address our disaster. So hospital disaster response equipment and supplies are basically the hospitals must maintain an inventory of essential items. So there are some essential items that our hospitals cannot do without, that we cannot provide services without them. So when we take inventory in our hospitals, we are able to actually identify that we do not have some of those items or those essential items, and we are able to procure them, or we are able to actually order for them so that they should not run short in our facilities, and we should not actually fail to provide services or respond to disaster. So some of them include medical supplies, and the medical supplies can be drugs. There are some drugs that should not always be out of stock. And then we also have communication devices so that we can be able to communicate. We need the Wi-Fi in different hospitals because we need to have internet, and internet can help us communicate. We need to have cell phones, and those cell phones can help us communicate when an incident occurs. Like in a different department, you're able to communicate either to the administration or to the security people so that they can be able to come to your rescue. So communication devices are very key. Then emergency generators should also be in place. When we don't have power, then we are able to handle some of the emergencies or disasters using the generators. Then personal protective equipments are also very key as part of our medical supplies. And then a life-saving equipment like the defibrillators. And these defibrillators are actually some of the equipments or their devices that actually gives a high energy electric shock to the heart of someone who is in cardiac arrest. So we need them because that is a disaster. When we don't have them, then we can lose our patients. So when you have some of this, in case of anything happening in the hospital, people can get shocked and people can get even a heart attack and so forth, and cardiac arrest. There are some who might have been caused by other conditions or the heart conditions, but there are sometimes whereby an incident can occur, and because of that, some people can get such cardiac issues. And when you have this equipment, it can help us actually to help in relation to awakening or helping to make the heart refunction again. So it is like a procedure which is called defibrillation, and this helps to save the life of someone in cardiac arrest. So that equipment is also good, and it is a life-saving equipment that we should always not ignore. If we are able to acquire it in our hospitals, then let's have it in our hospitals. But basically, we want to look at the medical supplies, communication devices, and then emergency powers, which is in relation to generators, personal protective equipments, and other life-saving equipments, having mentioned the defibrillators. So our hospital disaster response coordination and communication is key, because when something happens or when a disaster occurs, there is need to communicate. And when you communicate, you expect a response. So there should be a coordination on communication and response when there is a disaster. So coordination is very critical for a seamless response. So incident command systems have to ensure efficient communication. So resource allocation and decision making during these emergencies. So it's very key that we should have an adequate communication system that is so efficient in relation to disaster. Then we have also to have a good resource allocation on relation to communication. The different devices should be able to be given, and in that way, when we communicate and we coordinate, we shall be able even to allocate other resources that can help us support and help us to address the issues of disasters in our hospitals. Then decision making during the emergencies is very key, and you cannot have a decision when you don't communicate. So communication helps us to also get decisions from different individuals, and we are able to make the right choice or appropriate decision or choice of intervention to address the different emergencies or different disasters. So we also need to have all the four elements of a successful, effective strategic communication. So during disaster, therefore, we need to have a command, and a command is somewhere whereby there is someone to actually lead the team. Then we need to have a control, whereby in case there is something that is beyond us, somebody is able to control the rest of the team. Then coordination, we need to coordinate. We talked about multidiscipline, and we have different people to play different roles. So when there is that different kind of multidiscipline team, then we need to have a way of coordinating our roles and our responsibilities. And communication is performed through the incident command systems of every incident, and it has to be managed by an incident commander. So there should be someone in the team to command the rest on what they are supposed to do. Because if we don't have a commander or we don't have the team lead, then you realize that we may not able to address actually the disaster when it occurs. So in every hospital, there should be someone who is actually delegated the role and the responsibility of being the commander in managing disaster, so that when it occurs, he's able to lead the team, to command the team, to direct the team, to coordinate and have clear communication. So the techniques of coordination should be sound planning and simple organization, chain of command. So effective coordinators and sound leadership is necessary. So we need to have our leaders who are sound, leaders who know what to do, and when there is effective coordination and then good communication, we shall be able to address the disasters in our different health facilities.
So this is some basic indications. So when I
So we want to
discuss
look at hospital disaster risk assessment. We need to assess the risks in our hospitals. And when we assess risks, we are able to identify them and we are able to actually address them maybe before they even occur, or plan for how to handle them in case they occur. So hospitals actually conduct thorough assessments to identify potential risks and vulnerabilities. For example, they talk about earthquakes, the floods, or the pandemics. And pandemics can be outbreak of diseases in different ways. We had COVID, which came and people were not well prepared for it. So these are some of the risk assessments that can be done in order to help us address some of the hospital disasters. So these assessments actually inform the development of the response plan. So when you do the assessment, you are able to actually have a forecasted plan, which will help you to develop a response plan for these disasters. Since careful examination is done on what could cause harm to people, and this will enable various precautions to be taken to prevent injury and ill health. So risk assessment is very, very key when you're trying to make a work plan or to develop the response plan. You should have a proper risk assessment to help you identify areas that needs to be addressed, and to help you also take different measures and precautions to prevent injury and ill health to your community or to your staff or to your patients during the time of disaster. So hospital disaster response plan development. You need to develop a plan for you to actually respond to this disaster. So this is basically creating a comprehensive response plan that involves collaboration with local authorities, emergency services, and community partners. And it includes defining the chain of command and establishing protocols for evacuations, patient care, and resource allocation. So when you have a plan, it can help you in very many ways and can help you to address very many things. So I want to talk about local authorities. When you developed your plan and when you've decided that this plan should be to address the different disasters in case they occur, then your authorities need to be involved and they should know that in case this happens, what is the plan to help us address. So the different authorities need to be actually involved or collaborated within your work plan. Then the emergency services need also to be planned, because in case of anything, you are able to handle the situation. And the community partners, there is need for them to also be part of it. In case maybe you need resources, they can be able to provide you with different resources. So the partnership with these different stakeholders is very key, that you should involve them in your plan development. So it includes actually defining the chain of command and establishing protocols. So the chain of command is looking at who is going to be the commander, who is going to be the team lead in case this disaster occurs. And in that way, you're able to know that this person will lead the team and he's is actually having the sound mind. He knows what to do. He has the skills and ability to lead the team. And we have to establish protocols for evacuations. Evacuation is not only in the communities, but can also be in the hospitals, whereby you need to actually move your either patients or move your staff and the different people that you might be actually um, taking charge over in the hospital to a safer place. So evacuation is just leaving the place of where there is a disaster to a place where there is safety, and that is the the evacuation aspect bit of it. So you need to establish those protocols for evacuation in case it happens that a disaster has occurred and you cannot be in the same place where the disasters are taking place. Then you need to leave that area and go to a safer environment so that you can avoid actually endangering yourself or getting different kind of injuries. So establishing protocols for evacuation is important when it reaches to that aspect of living where the danger has occurred to where there is safety. So patient care is also very key. It has to be put in the disaster response plan. When you're making it, you have to include that, and also the resource allocation. How are you going to allocate your resources? But first of all, you need to know what kind of resources you need in case any disaster occurs, and what type of resources do you need, and how are you going to acquire those resources. Then there you can allocate the resources depending on how much you have and what kind of disaster you have actually assessed during your risk assessment. And then we want to look at hospital disaster response training. The hospital disaster response training is very, very key and very important. And I think every hospital should take this something very important, and it will help us reduce some of the disasters in our hospitals and also in our communities. So regular training ensures that staff are well prepared to execute the response plan. So you have already developed your response plan, and when you've developed your response plan, you need to have a trained team or the staff that are able actually to implement that response plan. So in that way, you need to train them. So when you train them, they can be able to actually implement the developed plan for disaster response. So training covers procedures. You need to let them understand what procedures do they have to actually follow, or what procedures take place during that time of disaster. Then they also need to know their roles, and we talked about sound leadership, whereby there should be a commander in that command or that control system of response. So we need to know the different roles. So every staff has to know his role and his responsibility in relation to disaster preparedness and safety measures during disasters. So everyone has to actually know about the safety measures, their personal protective equipments, and those are all safety measures. And we talk about different guidelines, knowing different procedures, different protocols in relation to either managing different disasters. So in training, it has to cover all that, and our staffs will be able to actually handle a disaster. So disaster well preparedness is very, very important for each and every staff in the hospital, and not leaving others, and others are trained. And when disaster occurs, those who are not trained can be culprits of the disaster. So everyone at least should be given chance and opportunity to learn and to know what is expected of him when any disaster occurs. So what could be the disaster response exercises? I want to say that there are different exercises that people can use for simulation, and when they do this, they're actually trying to prepare, and as they are preparing, they're also trying to actually train them with the knowledge and the skills on what to do in case disaster occurs. So hospitals conduct various types of exercises, including the tabletop drills and full-scale simulations, just to test the response plans effectiveness and also to identify areas for improvement. So when they do this, they are able to actually understand whether they are managing disaster, whether they have the skills to handle disaster or not. So that will help them to see areas of improvement, and they'll be able to support each other, and each one should be able to get the knowledge and the understanding on how to respond to disasters. And that tabletop drill is also called, sometimes they abbreviate it as TTX in short. So it's whereby the participants actually meet. They decide to meet in a particular room or in a conference or in a classroom. And when they meet there, they start discussing their roles on how they are going to handle disaster or a particular kind of emergency situation. And in that, they will have someone who is like a facilitator or a guiding person to help to guide those participants through a certain kind of maybe disaster of their choice, and they are able to actually do several scenarios. And when they do those scenarios, they're able to see the gaps, they're able to see the areas of improvement, and they will be learning on how to handle different disasters. So our tabletop drills are good in a way that each one is involved, each one knows his role, and each one is able to understand, in case a disaster happens, what am I going to do? So they basically just have kind of a simulation, like a drill, and then they just decide that in case this kind of disaster happens, what are we going to do? Then they give roles to different individuals. Then they have one who is a leader, and there should be somebody as a facilitator to guide them who knows more about actually disaster response, so that he can be able to guide them and direct them on exactly what they're supposed to do in relation to their different roles and responsibilities in the situation of disaster. So it's just a way of training people in relation to this. So it is like an exercise where people just try to simulate. Simulate is like demonstrating the real situation. In case it occurs, what should we do? So hospital disaster response evaluation. So after each disaster response, in case a disaster happens and you're able to handle it, after that disaster happening or after the occurrence of that disaster, you're going to evaluate. And when you evaluate, you're going to see actually your performance. How did you perform? How did you handle that disaster? And you have to seek for feedback. And by you identifying those areas for enhancement, it will help you also actually improve on your continuous quality improvement, and you're able to address the weak areas, and you're able to applaud the good areas where you did well. So this will help you to actually maintain your readiness. If you continue doing this, it will also help you to actually address some of the weak areas, and you'll be able to address some of the maybe resources that you didn't have. You'll be able to lobby them, and you'll be able to actually improve on your ways of responding to disaster. So hospital disaster response evaluation is very good for us to actually have continuous improvement in our readiness maintenance, or maintaining our readiness in different hospitals. So I want to say that when we have a disaster, let's not take it like it has happened, we have been able to handle it, and you leave it at that. But when a disaster happens, take it as a way of learning more. Take it as a way of you actually improving your skills on how to handle another disaster when it occurs. So do some evaluation on how you performed. What did you do well? What didn't you do well? And what did you have? What do you need to have in place? And by you doing that, you can be able to identify some of those areas that you need to improve, and then you'll be able to maintain your readiness. Um, Resources are needed, as I mentioned earlier on, that we cannot do activities without resources. And they say resources are always scarce, and when we are distributing them, we have to distribute them carefully and prioritizing where we put our resources. So hospitals can actually access guidance and resources from government agencies, because in disaster response, you cannot do it alone as a hospital, or you cannot do it alone as an individual, or you cannot do it alone as a government or a community, but you always have to seek guidance from different stakeholders, from different authorities, from different ministries, so that we can be able to appropriately address our disasters. So hospitals can access guidance and resources from the government agencies. Different governments from different countries support their communities, support their hospitals in relation to disaster occurrence. So when you look at example I can give is the pandemic which occurred, the COVID-19, the government agencies actually supported their different hospitals in a way that they're able to provide the PPEs, they're able to provide different resources, the equipments in relation to the management. So the guidance and resources from government agencies is very, very key and is very necessary. So we need to involve them. And then the healthcare associations, we have different healthcare associations that can also give us our resources in relation to maybe drugs, in relation to protective gears, depending on the type of disaster that has occurred. And online tools, there are different tools that we need. Either we need tools for collecting data, and that data can be used for actually helping in decision making. It can help us in planning. It can help us to address a number of issues, even budgeting. So we need these tools, and we can get them from those different agencies, even government and other health care associations and different um, private individuals. So these resources help in planning, training, and resource efforts. And response efforts are basically the help or the support that they can give us. Some of them can actually come in the site and provide their support in the site. And they can give us resources. They can also come and give us the different expertise to support different kind of interventions in relation to disaster response. So another example of response efforts can be um, the different skills that they gave to different hospitals, different professionals, the nurses, the doctors, and the rest were actually distributed in different parts of the hospitals during the time of COVID. So you realize our government and the different private organizations or agencies were able to respond in different ways. So we cannot actually manage to handle disaster in our hospitals alone, but we need different stakeholders to help us in response in relation to resource provision and supplies. So I want to say that when you have a disaster, the first thing you do is preparedness, and preparedness is basically looking at how you have planned to handle your disaster in case it occurs. So preparedness is very, very key and to help us to mitigate the occurrence or prevent the occurrence of disaster. And it needs resources, it needs skills, and it needs support from different stakeholders, including our government. Then the second stage of disaster management is response. In case you have failed to prevent or to mitigate disaster and it has occurred, how are you going to respond? So this comes along with how you prepared to handle that disaster. So when you have adequate preparation, you developed a good plan, and you're able to actually have enough resources, then you can be able also to see that you're able to handle or to respond to this disaster. So the plan on how to handle the disaster, the resource allocation, the organization in relation to the different individuals handling different roles and responsibilities is very key during our response to the disaster. So the other one, after disaster has occurred, that is the cycle in relation to managing disaster. The first one is preparedness, the second one is response, and the last one is recovery. So in case now you have responded, and when disaster occurs, we very well know that there can be damage in relation to either our properties, it can be in relation to even human life. So how are we going to recover from that disaster? So that is the brief cycle of disaster preparedness or disaster management. So the disaster is supposed to be handled in three ways: preparedness, response, and then recovery. So even in preparedness, you can be able to create awareness to the different individuals. After you carry your assessment and you realize that there is a disaster that is going to occur, then you have to inform the individuals around that area to know, and they can be able to evacuate. I remember we had that term in one of the slides that you have to prepare for some of the procedures and guidelines or protocols on how to do the evacuation process. So, evacuation is basically removing people from the area of danger where the disasters occur to the area where they are safe. So, we need to do this during our preparedness of disaster, and then in response is when you need to evacuate them. So when we evacuate them, we are taking them to a safer place to avoid the danger as we address actually what has happened in that area. Then recovery, we help these people come up from the state they were in to actually try to improve their life back to the normal in relation to before the disaster occurred. So preparedness is very key, response is very key, and recovery is also key because we need to rehabilitate these people. We need to recover from that disaster so that we can continue having the normal life. So I really want to say that disaster preparedness is very important. It's a topic that we should understand because disaster does not occur only in the hospital. Disaster cannot occur only in the community. Disaster doesn't occur in the different organizations, but disaster can also occur in an individual or in families. So when you know how to handle disaster, you know how to plan to be prepared, to respond, and also to recover from disaster, then you can be able to handle even your own situations. So hospitals need to know how to prepare for disaster and respond in times of disaster. So there are a number of key things that we need to know, what we need to have during the time of preparing for disaster, what we need to have during the time of responding to the disaster, and what happens after the disaster. So I want to appreciate each one of you, whoever has managed to be online to listen to this presentation. And I call it that we are done. This is the end of our session. We had a short session, and thank you very much. Bye.
The second step is that smart correction is done often through interpretation of the smart